Okay, folks, I understand that there's apparently an AIDS epidemic in Atlanta. A lot worse than I apparently thought it was. 1 in 2 gay men in that city is apparently coming down with the HIV virus. There's a couple of avenues of approach. Well, let me first explain a few things. One, AIDS virus can transmit through groin sores, bleeding hemorrhoids, and needle sticks, whether intentional or unintentional. Okay, so one, protected sex does help in some situations, but not in all. If you either have unprotected sex or you have groin sores or hemorrhoids, then you want to take PrEP treatment regularly while this bubble in the AIDS virus spread in Atlanta is occurring. This will keep you clean of the virus, and it will keep you from transmitting it if you have the virus and you have any of those symptoms. So if you have the virus, please take PrEP treatment. It prevents the transmission of the virus. If you have groin sores, hemorrhoids, or you like using needles for drug use, or even if you're diabetic or something, make sure to use PrEP treatment. When you get into a situation where you might have sex with somebody who has groin sores, or share needles with somebody, or you find out they've got hemorrhoids, this doesn't matter whether you're man or woman either. Okay? Make that point quite clear. It doesn't matter if you're a man or woman. By groin sores, a woman can catch AIDS. It's a simple matter of the semen hitting the bloodstream, or the blood hitting the bloodstream. That's all it takes. So if you have groin sores, you need to be on PrEP treatment. This will prevent you from catching the disease. And if you have the disease, it will prevent you from giving it to somebody else. If you find that you don't have groin sores, of course, you should know that. Then, if you accidentally find out you've had sex with somebody who does have groin sores, head to the hospital. You need to be in an emergency room and get PEP treatment. PEP treatment is a treatment that has to be started within 48 hours to be effective. You can wait to 72 hours, but it's not as effective. Nowhere near as effective. It's almost 100% at 48 hours or less. If you can get that started, you can keep yourself clean from this virus, as they say in Africa. So once you take that 4-week treatment, and it's a 4-week treatment, it varies depending on which medication you're using as to how many tablets you take a day. But it's a 4-week treatment, in which case you don't want to have sex during that 4 weeks. You want to have AIDS tests done regularly during that 4 weeks. Usually at the very beginning, when you think you were infected or exposed, it doesn't matter whether the guy's got it or not, you need to take the precaution. He may not necessarily test positive, but he may have it in his system. Undetectability usually means non-transmissible, but not always. So I prefer the not always part of that, because it means, well, you should take this treatment just in case. It's better to be in case than to be arrogant and say, well, it'll never happen to me. So take that PEP treatment. This should slow down the spread of the virus. I'm not a medical doctor. I do mathematical research, not medical research. And most of this is proven out, well, it's basically all proven out with mathematics. I've read on several my Swaziland and AIDS detection video and a couple other videos I made. If you look on YouTube, you can find, if you look on my channel, you can find a lot of information. And then just, if you tap on that little triangle thing next to the title of the video, a pop-down menu will pop down. You can scroll up and down, and you can see some of my statistics, my equations, and everything I've come up with. They basically are either USA or Swaziland, or USA and Africa. Since we're talking about Atlanta, let's get on with the system. Once you've determined you've been exposed or potentially exposed, whether you shared needles, had sex with somebody with hemorrhoids, or had sex with somebody with groin sores, these are the primary methods of infection in Africa. I don't know if this is AIDS, hive subtype C or not. In the part of Africa I studied, it was hive subtype C mostly. But the thing about the hive subtype C is it killed something like half of the people with HSV, which is genital herpes. So there's a high rate of genital herpes in Atlanta too. So black men, which are the most affected in Atlanta at a 1 in 2 rate. Also, if you look at the U.S. black male population, they have almost a 1 in 2 rate also of genital herpes. So if this is type C of hive 1, then what we're seeing is the same thing we saw in Swaziland. The only way to deal with this is to use PrEP treatment and PEP treatment. The PrEP is to prevent. The PEP is to prevent. PEP technically is a cure if used right, but they like to call it a preventive medicine. Anything taken after you've contracted a disease is actually a cure, but that's some semantics. I'm not going to get into that anymore. This preventive treatment, either one of the two preventive treatments, as they call them, are good. They have 90+% reliability, which is fairly decent. So that's something that you've got to consider if you're in Atlanta now. If you have sex with somebody with groin sores, PEP treatment. If you have groin sores, you need to be taking PrEP treatment. Sounds like the same, but it's not the same thing. PEP is post-exposure prophylaxis, meaning it's taken afterwards. PrEP is pre-exposure prophylaxis. It's taken before you have sex. And it's got to be in your system. It's kind of like a psychological medicine. In order to be effective, it's got to be in your system. And it's got to be in there, it's got to be built up to a certain level to be effective. So knowing these things, what we're seeing now in Atlanta could probably be better controlled with the proper use of medicines. In Africa, through a variety of methods, they've been able to do this. So watch out for groin sores, hemorrhoids that are bleeding, groin sores that are bleeding, hemorrhoids that are bleeding, or if you have mouth sores that are bleeding. Very rare, but can happen. Using syringes or needles and sharing them. All of those are things you want to watch out for. If you've got groin sores, you need to be taking PrEP. I don't care if you don't have the virus yet or not. It will keep you from catching it if you get exposed. If you've got groin sores during this period, you definitely need to be tested regularly if you're having sex, particularly if it's more than one partner. This is very important. We're talking about monthly tests during this period. Until they can get it under control, you're talking monthly tests. If you're going to have sex in that area, particularly gay sex, you need to be tested monthly. Literally. Particularly if you've got groin sores, hemorrhoids. If you've got hemorrhoids as well, you need to be tested. If you're having sex, them hemorrhoids can bust and bleed on you, just like a growing sore can. If it bleeds, that's direct access to the bloodstream. That's all that semen needs. That contaminated semen, or if you are talking about a woman, contaminated growing sores, again, if they bleed, that's direct access. Now, let's look at something else. In the United States, 10 to 20% of people have growing sores due to HSV, depending on where you're at. It varies. Of that, 4 percentage points of that is black males. Most of them are in Southeast United States. Okay? Now, 0.6% of your black males have AIDS. I don't know, from what I'm hearing in Atlanta, it may be hitting more like 30 or 40%. Now that comes to, if you figure the 10 to 20% rule of concerning growing sores in the general population, and you figure the 4% for males that have the growing sores, the 4 percentage points, that's anywhere from a 20% chance that a black male is going to have growing sores, all the way up to a 50% chance, depending on the population area where you're at. It probably can get worse than that. Okay? Now, of your black males that are living with HSV, which is called growing sores or genital herpes, of that 4%, 4 percentage points, 13% of those men, 1 in 8, have high AIDS. Okay? They're infected with the high virus that causes AIDS. That's just mathematically figured out. You just take the statistics and you throw them together. It's like, well, I have to put it to you. Let me tell you how to do that. First, you take the figure from the University of Washington study of 2006, HSV, HIV. 80 to 90% of AIDS victims were living with genital herpes. Okay? Now, we're going to change that. We're going to go in there and figure it for genital herpes. How many of them are living with AIDS? That's a different way of looking at it. So I'm going to look at this different way. If you figure 0.6% of black men have AIDS, you times it by the higher number. We're going with the higher number just to make it easy to go with. If you times it by the higher number, okay, that's the 90% figure. 90% of 0.6 is 0.54%. Still not much. But 0.54% divided by the 4% that comes from the black males that have the genital herpes brings you to a 13%, which is 1 in 8, have AIDS. Or at least the virus that causes AIDS. Not all of them are in AIDS. But they have the high virus that causes AIDS. In a general population, it's just under 3%. So that means black males have, roughly speaking, about a 5 times greater, just under 5 times greater chance of living with AIDS if they have growing sores. And that's the general population nationwide. That ain't Atlanta. Atlanta's apparently having it worse. Just look at that, think about that general figure there. And the fact that Atlanta is apparently having it worse. This has been unusually long for me, but I figured I should put that information out there and try to explain it. But remember, if you've got growing sores and you're a gay man or a woman or non-gay man and you're black, or maybe even white. I mean, I don't know that much about how many whites are coming down with it. I've only seen the black statistic. But if you have growing sores, you need to be on PrEP treatment. That's to prevent you from catching the disease. If you have AIDS, you need to be taken. If you have HIV because of AIDS, you need to be on PrEP treatment. That prevents you from transmitting it. If you go in and you have sex with somebody and you realize they've got growing sores, or you've shared needles, or they have hemorrhoids, you need to go get PEP treatment. It's an emergency. That means the emergency room. I hope they have doses for you. They usually use it only in medical emergencies for doctors and stuff, but they need to expand that. And now, if you've got hemorrhoids, you need to take PrEP treatment. Particularly if you're having gay sex. Or if you're a woman and you're having anal sex. You need to be on PrEP treatment. Know your hemorrhoid status. You need to know if you've got hemorrhoids. And if you're having anal sex, you need to be checked regularly for hemorrhoids. And if you have hemorrhoids, be on PrEP. That's what I would do if I was in your shoes and you were in Atlanta right now. Well, Thomas Wills out here. Have a good day.